A patient with a history of ILD status post-lung transplant is admitted for upper GI bleed. The patient has a hemoglobin of less than 7, and you wish to transfuse 1 unit of PRBCs. When ordering this blood product, you have lots of options. What might you choose here? Washed, leukocyte reduced, split, irradiated, or some combination? I'll give you a little bit of time to think about what you might select. And so in this case, I'm going to argue that it's leukocyte reduced and irradiated blood. Let's talk about packed red blood cells, or PRBCs. These red blood cells that are obtained by taking whole blood donations and processing them. The administration volume for 1 unit is typically 250 to 300 cc's. And whenever the blood is issued from the blood bank, it actually must be completely administered within 4 hours of being released. And that's because it needs to be at a certain temperature when being administered. There are lots of different ways to prepare RBCs, so I want to go over a couple of them. So washing involves removal of the extracellular proteins in the donor plasma. And so when you do that, you decrease the risk of anaphylaxis to blood from the donor. This is a really important step in patients with IgA deficiency or those who have a history of anaphylaxis to blood. So if you have either of those things, you will want your RBCs to be washed. If you have PRBCs in patients with a transplanted organ, you have to have some extra considerations. And so you have to understand that giving blood products actually generates HLA antibodies. And so these antibodies will end up reacting with the transplanted organ. And so you can actually get transfusion-associated graft versus host disease. The key to reducing the reactions is to decrease the number of lymphocytes and their ability to proliferate in the donor blood. And so there are 2 ways to do that. The first way is to do leukocyte reduction, and you'll see this abbreviated as leukoreduced. And this filters out the white blood cells in the donor blood. And that does 2 things. When you have fewer lymphocytes, you decrease the risk of febrile transfusion reactions. And when you irradiate the blood, when you leukocyte reduce the blood, you will also decrease the risk of CMV infection because CMV lives in the monocytes. So the amount of CMV that you're potentially transmitting goes down. The next thing that we do is irradiation, and this will inhibit lymphocyte proliferation. And so if you don't have as many lymphocytes proliferating, you have fewer lymphocytes, and that will decrease the risk of transfusion-associated graft versus host disease with that acronym there. So in summary, we're going to go over the modification, the purpose, and the medical status of the recipient. If you have a washed PRBC, the purpose is to prevent an allergic reaction, and this particularly pertains to IgA deficient patients or those with a history of anaphylaxis to a blood component. We have leukoreduced blood, which will prevent the transmission of CMV. And so if someone has received a transplant, this is an important thing to do. Irradiating the blood will prevent transfusion-associated graft versus host disease, which again is important in patients who have received a transplant. And finally, one little add-on, it's not truly a modification to the RBC, but the way it's delivered is a split RBC. And so that volume of 250 to 300 cc's all stays in the intravascular space. And so that is the resuscitated equivalent of 1 liter of a crystalloid, such as normal saline or lactated Ringer's. And so sometimes what we'll do is we'll split the product. And when you do that, because there's a 4-hour administration window, you can give half a unit of RBCs over 4 hours, call the blood bank, and get the other half for another 4 hours. If you give it slowly, you reduce the risk of volume overload, the clinical entity often being TACO, transfusion-associated circulatory overload. One thing that I will say is that if splitting is not logistically feasible at your hospital, you can consider administering a loop diuretic with the PRBC to reduce the amount of volume expansion that is caused by giving blood. And that's it.